Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, Attorney Kim Hegwood of Your Legacy Legal Care, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and our very special guest today is Jen Stone. Good morning.
Good morning. Thank you for having me, Kim.
Well, I'm super excited, and so because we're going to talk about Medicare in motion, what Texans
Okay.
need to know in 2026, because they're always changing everything.
Every
And
year.
so, and when I started, thinking about this, and it was like, because then I realized that there were things when I was reading through some information, and realized that it's obviously very important for adult children to have access to their parents' Medicare, right?
Very
And
much.
and then I was thinking, I don't have access to my mom, so now I got to fix that.
Mhm.
So I'm like, it's lovely to be on to have a podcast, and then think, oh, now I got to do a little bit of work.
Yeah,
So,
you do. It's really important in so many ways. Everything that when you reach that stage in your life and you're an adult child, you are at some point going to have to step in. You're going to have to make sure you get your parents to the doctor. You're going to have to meet them in an emergency room. And you're just going to have to make sure they're making solid decisions about their Medicare. So, having access to it, to the summary of benefits, that little booklet they sent out with all the details is really critical. Carrying it with you can just come in super handy. And also call that insurance company and make sure your parents say, yeah, this is my kiddo. And she can talk to you whenever she wants about all things about my insurance, because having that power allows you to step forward whenever you need to.
well, I think that's important. And so the middle sister is usually the one that's very involved with mom's, medical stuff. And so even if she doesn't go, she makes mom put it on speakerphone so she can listen
Yep.
to everything, and so which I think is important. I think every kid should should have parents do that. And so because there's a lot of times that you miss things, that you don't doctor says something and you miss it, or and you
Yep.
don't relay all the information. So I think it's really important. So I believe it's like Texas has been selected as one of the 6 states in the new, they call it
The
the
wiser
Wiser
program.
pilot program.
Yeah.
And and in this program, I read it requires authorization for 17 procedures under traditional Medicare.
Yeah. This
Um,
is brand new.
so I hadn't heard anything about it. So what should Texans know how this pilot works, and who does it affect?
It's going to primarily, or it will only affect people with only parts A and B, and people who have a Medigap, or also what's known as a supplement, the Plan G and the Plan F. So typically in the past, when you have that plan, authorizations are just not part of it. Authorization meaning my doctor ordered one of the 17 items on the list. And normally you would have just been able to say, great, I need a certain kind of wound care. I need a certain type of knee surgery. These are things that are on there. Cervical fusion for your neck is on there. And now that has to be authorized. And it's so important to know, because if it's not authorized, it's not going to be paid for by your insurance. So that's critical. And it is your doctor's responsibility to get that authorization in place.
So why are they second guessing procedures these days? I mean, what causes that?
A couple of things. Number one, several of these procedures are considered overprescribed. They are not necessarily proven to be beneficial to a 65 plus population. So in Medicare, they're always aware of what is being overprescribed that is not benefiting the member. As tedious and complex as Medicare is, it is designed to protect its members. And one of those things is making sure that they are not subject to procedures that are not going to necessarily help them. There's a ton of excellent doctors out there, and there's a few that just sort of make people have to question, is this the right thing for me?
So the cynical part of me says, we're getting older. Medicare doesn't want to help us stay alive.
You're
So,
right. You're exactly right. So yeah, there is that aspect simply because this hasn't been proven out, right? This
yeah.
has not been proven out to work. We're probably not going to know for 18 months. And I will also share that a lot of the reason this pilot is happening is they're running these authorizations through AI. So when the request for authorization comes to Medicare, it's going to go through AI. And if it is denied, then a real person will look at it. So it's really hard to say in medicine where AI should step in and where it shouldn't. And I think the pilot with the technology aspect of it is a lot of why it's happening.
It's like I've learned a lot about AI, because it affects, my practice, all kinds of things, in different ways, but it's not smart enough yet.
It,
It's got a lot to learn.
there's
And
and when it comes to healthcare, there is a tremendous amount of nuance.
mhm.
Everybody is different. And one 70-year-old may be running marathons, and the other 70-year-old may be dependent on a walker and oxygen. There's so many variables. So to run it through AI and hope it captures all the nuance, that's a big ask, in my opinion.
Yeah, I'm not going to hold my breath on that one. And so I just don't think we're not so sure we're ready for that. But it's good to know because it's definitely good to know because I think a lot of times, the Medicare says, "Oh, we're not going to cover it," and then you don't know why. You haven't,
Yeah.
you're not really sure, procedures and things like that. And so, but will it make a difference in the changes, for rural areas versus urban, you know,
Absolutely.
and what should listeners in different regions be watching for? Because, my mom is in a smaller community, so she has a supplement with her Medicare.
Okay.
So somebody like her, what things should she know more of?
That's a great question. So the fact that this is technology based means that you have to have the technology on your end as the provider to submit these authorizations. And in rural areas, especially rural hospitals, they're not always as well funded. So they may not have as much funding to get this in place because I don't know where the funding's coming from, quite honestly. Number two, are they staffed well enough? Do they have the right people on staff who are going to be able to submit these authorizations through this new technology? And that's resources are always an issue in healthcare, in rural areas even more so. So you'll have people running double duty. You may have, the nurse practitioner having to figure this out, and that doesn't always benefit the patient.
No, and no, I find that a lot of things kind of lapse because people don't know how to fix problems.
Yes,
You know.
yes. And you don't always have a good advocate. I'm also a board certified patient advocate. And if you don't know how to advocate for yourself, or you don't have someone who can advocate on your behalf, and perhaps the denial comes and you don't have someone who can go back and say, hey, this really needs to happen. What can we do to make it happen? It just may not happen at all. And again, not necessarily in the patient's best interest.
So So what about, it's like I'm almost sorry I asked about all the changes that are happening in Texas today. So but let's talk about stuff that's really important to people like my mom. Prescription drug coverage, out of
Critical.
pocket cost, Part D formulas that has to do with your prescriptions. What shifts are coming to that? What do we need to be looking for? Because that's a big thing. I know it's a big thing with my mom because she takes number of different medications and and my middle sister, she, Terry, I'll shout out Terry, she's a rock star. She knows all the least expensive place to get each medication, you know.
Critical.
And
Critical.
so, and
Yeah.
she's done the shopping and everything, in that aspect of it, So what else? Just people like her taking care of mom's stuff. What does she need to know?
I will start with some good news. How about that?
I
Um,
like good news.
The Inflation Reduction Act, I believe, of 2021 had a clause in there that allows Medicare to negotiate on behalf of its members for the first time to get lower drug rates. So before, they didn't have control over that. The insurance company did, but Medicare itself did not. So now, every single year, starting last year, there are 10 to 15 drugs that will be reduced. And my best examples for this year are Eliquis, Xarelto, and Jardiance, typically very expensive drugs. Those drugs are going to be reduced. There's negotiation power. So what you can look forward to is see if your drugs are on a list and they're going to be less expensive, which is fantastic. The second thing I will tell you, and a piece of good news, there's a new program out there that started last year called the Medicare Prescription Payment Plan. So let's say you walk into the pharmacy and you're hit with a $900 drug. That is terrible for cash flow, right? A lot of people can't cough up $900, but you can turn around, call the 800 number on the back of your insurance card and say, hey, Jan Stone said there's a Medicare prescription payment plan. I want to be on it. And they will allow you to make payments each month through the remaining months of the year. So you don't pay the pharmacy, you pay the insurance company, and you make payments on it. Just like Amazon has that pay with Affirm and make it in so many payments, right? It's the same thing. It allows you to make payments. So that's one thing. The third thing I'll talk about that is the most important thing you can do is review the benefits every year. They are going to change. We went from 15 to 12 insurance plans this year in 2026. Do I expect that to shrink some more? Sure, I do. Do I expect some plans to cover less drugs? Yeah, I do. So do the homework, talk to a broker, go on Medicare.gov and go through the process, but make sure you review it every year. Put on your calendar, man, October 15th through December 7th is your opportunity to change drug plans. You don't want to wake up on December 8th and say, man, I forgot to review it and I'm stuck with this drug plan. And guess what? My drug's no longer on it.
Yeah.
Keep an eye on it. Cost, if the maximum out of pocket went from $2,000 in 2024 to in 2025 to $2,100 this year, I would expect that to increase in terms of the most you'll spend on drugs in a given year.
I think January is the most painful month.
January, you get hit hard. You have to meet that deductible. This year,
Yeah.
it's $615. That's
Yeah.
a pretty big increase over $585 from last year. So yeah, January's tough. That payment plan can come in very handy.
Cool. That's good to know. And so what practical steps can adults and caregivers take to navigate this, confidently? And how can experts like Stoneworks Benefits support them through the transition?
That I talk about that a lot. I think the most important thing to do when you're shopping insurance is to talk to a broker who provides a few things. Number one, they represent multiple plans. You need a choice. I would say on any given day, there are 45 Medicare Advantage plans to pick from. There's probably 20 supplements to pick from. You need someone who's really agnostic in that sense and will review all of them with you. Number two, they need to ask you some questions about really personal things, money and health, because it's really hard to help someone if you don't know what their health situation is or what their financial situation is. So feel okay talking about that because that's going to get you the best result. Number three, two more things. Number three, if you see it on TV and you think it's true, my bet is it's not. A lot of those ads in TV are geared towards people on Medicaid, and they really want you to call and they're going to talk you into a plan. And I'll let you in on a secret. When you call those 800 numbers, those guys are paid by how fast they get you to sign up.
Yeah.
So keep that in mind. The last thing I'll say is, and to me, this is the most important part of my job, you need a broker who's not going to leave when the ink is dry. So a broker gets paid a commission every year you're with them. I see my responsibility is being available to you 365 to answer your questions because it's hard to negotiate. That book of summary benefits is great. It doesn't mean it's going to make sense to you. It makes perfect sense to me. So make sure you choose a broker who is available to you all year so that when you have questions, call them up, ask the question. And I mean, my folks know, text me. If I can get back to you, I'll do it right away, because a lot of times those questions come when you're in the doctor's office.
Yeah, definitely. So, Jan, if somebody wants to reach out because they need a nice broker that knows her stuff, where do they find you?
You can find me online, stoneworksbenefits.com. You can call me. I live in Austin, Texas, but I work all over the state in terms of supporting people. My phone number, 512-582-2266. And feel free to call just to have a conversation. Just call to say, I'm not sure I'm on the right plan. I don't care what time of year it is, but it's so nice to have confirmation. And then I also do, and I think this is great, a monthly webinar where you can just pop on once a month and say, what's happening in Medicare right now? And we'll go over it. And if you can't make it, then we'll set up a one-on-one to do it.
So that's perfect. Jan, this has been fantastic. And so I so appreciate you being on the show today. And we look forward to having you on again soon.
I really appreciate it. Thank you too.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.